Welcome back to the Taiwan Outlook. I'm your host, Wu Ruiguo. In this segment, we will continue our discussion with Dr.涂醒哲, a former health minister in Taiwan and currently a member of the Legislative Yuan. Dr. Tu,
yes,
we are now in the global village.
Yes.
People travel all the time for business, for personal, for leisure reasons. How can we then, in the global village, try to contain the spread of epidemics such as influenza A and other diseases to better protect and prepare for the challenges ahead?
And I think this also in the public health level.
Of course.
It's very difficult to restrict the
Yes,
travel.
of course.
Even you restrict, some people still go. Even you put the light to yellow light, to the red light,
Yes.
some people still go because
Still
of
travel,
the
yes.
business or some kind of personal reasons.
Yes.
So that the restriction is not so easy to do. And I just mentioned that the efficiency of the government
Yes.
is different for every country.
Of course.
Yeah. Taiwan is, I think, on the better part.
Yes.
But some countries not so good.
Yes.
So I'm afraid the disease will spread over and over. And maybe until maybe half people of the whole world
Yes.
infected, then the infection will
Reach
step
a
up.
peak and decrease. Okay.
Decrease. So it's so difficult. So how can we protect ourselves in
Yes.
a public health level,
Yeah.
not in the individual? Individual, I say that
Wash hands.
wash hand and
Wear the mask.
wear the mask when you are get infected. For the public health, still the most important is the control this, contain this infected patient on the border.
Yes.
That means that you must check the
temperature,
travel,
yes.
check the temperature for the travel, and educate the traveler on the plane and ask for their cooperation. Because during 12 hours or even 16 hours traveling, I think this is very crowded situation, easier to spread. So you must tell them, educate them, not take analgesics. I mean that not take antipyretic.
Yes.
This is to decrease the temperature. If you have any symptom, any discomfort,
Yes.
please tell us. We will offer you the mask.
Yes.
And also maybe put in a more isolated area
Yes.
if you have disease. Something like this. Now people must help, but this is we must do on the plane. And we must check this. Some countries by the reporting that
Yes.
I have fever or I have malaria or I have some symptoms.
Volunteer that information.
Or
Yes.
I have visited some patient.
Yes.
Or some my friend have infection. Maybe only a cold malaria or maybe a cold, but must report. Some countries use this.
Okay.
But you can educate them, ask them to report as many as possible. I think this is most important.
Okay.
The second part is we call it nosocomial infection or hospital infection.
Okay.
Because in most cases we send to the hospital.
Yes.
And not every hospital has this we call the negative pressure isolated room.
Okay.
In Taiwan we have this, but maybe in other
Not in other countries.
No. But even in Taiwan, we can put into the negative.
Okay.
But if you are not be very careful, this will spread in the hospital.
Okay.
So it's not so easy to start the spread in the community, only if the case cannot be controlled in the hospital or in the border.
Okay.
So that we must put the border control and the nosocomial, or we call hospital infection control.
Okay.
This is most important for our government now.
Okay. And from this experience in
Yes.
combating the influenza A,
Yes.
Dr. Tu, what are the public health issues or problems that you see in Taiwan that we need to pay more attention and devote more resources to try to make sure that people living in Taiwan or traveling into Taiwan are better protected?
You mean
What are
that
the
for
other
flu
public,
one?
yes,
Or just,
not just in terms of flu, but other areas as well.
Yeah, I don't want to mention about the individual because at this point, most duty, most responsibility is from the government.
Yes.
That the border control, the hospital infection control are most of government work. So I will ask our government not say too much.
Okay.
Too much to the people.
Okay.
Because if there's so many cases, that's nonsense.
Yes.
You just tell them wash your hand, wash your hand, wash your hand.
Okay.
Not wear mask. That's good enough.
All right.
Now we must train our doctors.
Okay.
To be
health
alert,
professionals. Yes.
alert enough.
Yes.
Every patient have any kind of diarrhea or common cold symptoms, that's cough, sneeze,
fever.
You must ask the travel history. Where you go, where do you go? This must be alert, not just prescribe the medicine. Okay, stop the sneezing, stop cold. That's not good enough. You must be very alert.
Okay.
And for that hospital infection control, you must train people. Be very careful how to take care of patient.
Yes.
Not spray this, wash your hand. This is even more important in the hospital. Usually we think that doctor and nurse will be very careful. No, because
not always.
no, not always. You must mention this again and train again. And if more cases come in, how can you do? You must prepare first.
Of course.
How to isolate, how to transport. I think this is very important now for our government.
Okay.
And not say too much thing about we have enough medicine, we have enough vaccine. That's not important now. You just do that.
Okay.
But
enforcement.
Not say it again. Make people so nervous.
Panic.
Think something come already. No, not yet, because the responsibility
is
now depend on the government part.
Yes.
We have no community spread yet.
No.
So not threaten our people so too much.
Okay. Yeah. And Dr. Tu, we understand that sometimes, maybe it's difficult for government, as you are one time of the health minister.
Yes.
Maybe it's difficult for government to try to do all these public health issues or problems all at one time. So we may need the participation of NGOs, non-governmental organizations. As far as you know, do we have many active NGOs in Taiwan in the area of public health that have been effective in terms of helping the government, in terms of educating the public about some of the threats to public health?
And we have no this kind of NGO just by the people, just like consumer service NGO. Then they can do attention because it's too specific.
Yes.
And just
very specialized.
Very specialized. So that our specialized NGO, just like a medical association or infectious disease association, I think they all get involved.
Okay.
But I think that's not enough.
Not enough.
I think that the Dancing Association, even they cannot give some kind of suggestion now.
Yes.
This is more specialist, more specialist responsibility or their ability can give suggestion. But to work in or to prevent spread, nursing association is very important. And I always think because this is a pandemic and also panic. So that I will advise my government to include some we call social psychiatrist, psychologist, social psychologist, or we call social behavior scientist, because they will advise the government how to deal with this
on the
people's
community level.
panic.
Yes.
Yeah, not just say this, that's not good. So that we must include social psychologist, behavior scientist, and also media people.
Media.
Yeah, I think this is important. They must recruit these people as a consultant now.
Okay. And since we are now in the global village, we cannot fight, the influenza A and other diseases alone. Who are the major partners that we can correspond with? And we also know this is the first year that Taiwan is able to return to the World Health Assembly as an observer. Do you think that participation at the international level will be very important? And what can Taiwan do to contribute in that endeavor?
Yeah, I think this is the most important part when we discuss this kind of a new infectious disease. And this is maybe the only or the important reason why we need a World Health Organization.
Yes.
But because every country, there is ministry of health.
Yes.
They can do public health work.
Yes.
Why we need a World Health Organization? Because that new infectious disease is beyond the border. This can spread to so many country to country.
Yes.
And this is especially true for Taiwan.
Yes.
Because Taiwan is an active business country.
Yes.
So that we travel a lot. Almost 10 million people traveling in
all over the world.
All over the world. And every year about 4 to 5 million people go to Hong Kong and China. So that we are so easy to
be exposed to
other disease and also bring disease to our country, Taiwan, and also spread it out. Because the incubation period is so short. And the traveling and time
so frequent.
Is so frequent and so fast. You can take only a couple hours from here to Japan to Hong Kong. So usually we come back from China and go to Japan tomorrow. Just during the incubation period. So that we need the cooperation of other countries, especially
at the international
World
level.
Health Organization. I'm happy that this year we can join, but we still not put a name on the list of World Health Organization. So you cannot find how many cases from Taiwan. It's very...
So we still need to improve on that.
That's right.
Thank you, Dr. Tu. And we're going to take a short break. We'll be right back to the Taiwan Outlook, and we will continue this conversation with Dr.涂醒哲. I'm going to ask him the different roles that he has played in his career, and which role does he prefer the most. We'll be back in 3 minutes.